Hey everyone, today I'll be talking about wound and wound healing. Wound is defined as a break in the integrity of the skin or the soft tissue which may be associated with disruption of the structure and the function. Wound can be classified into various types, some of which include either it can be a simple wound or a complex wound. In simple wound, only skin is involved. In complex wounds, vessels, nerves, bones, or tendons are also involved. Or it can be classified as a closed wound or an open wound. Closed wounds can involve contusion, abrasion, and hematoma. Open wounds can involve an incised wound, a lacerated wound, crush injuries, and penetrating wounds. Or wounds can be classified as tidy wounds and untidy wounds. Also, there is a classification of surgical wounds, which can be classified as a clean wound, a clean contaminated wound, a contaminated wound, and a dirty wound. Wound healing is a complex process to achieve anatomical and functional integrity of the disrupted tissue. Wound healing involves the following phases. The first phase is the hemostatic phase. The second phase is the inflammatory phase. The inflammatory phase starts immediately after the wound and it lasts for about 2 to 3 days. It is characterized by vasoconstriction and thrombus formation. The platelets stick to the endothelial lining of the vessel, releasing adenosine diphosphate, which causes thrombocytic aggregates to fill the wound. When bleeding stops, the platelets release cytokines, which include the platelet-derived growth factor, the platelet factor 4, and the transforming growth factor beta, which attracts the inflammatory cells such as polymorphonuclear leukocytes and macrophages. The platelets and the local injured tissue release vasoactive amines such as histamine, serotonin, and prostaglandins, which increase the vascular permeability, aiding in infiltration of the inflammatory cells. The macrophages remove the devitalized tissue and the microorganisms. Initial framework for structural support is provided by fibrin. The second phase is the proliferative phase, which starts on the third day and lasts for around 3 to 6 weeks. It is characterized by fibroblast activity and production of ground substance such as glycosaminoglycan and proteoglycans. It is also characterized by formation of new vessels known as angiogenesis and is also characterized by re-epithelialization. The wound tissue formed in the early part is known as the granulation tissue. In latter part, there is increase in the tensile strength. Also, it is associated with wound contraction. The last phase is the remodeling phase. The remodeling phase starts on the 6th week and lasts for around 1 to 2 years. It is characterized by collagen maturation and realignment and also is characterized by reduction in the wound vascularity and wound contraction. Factors affecting wound healing can include site of the wound, structures involved, mechanism of wounding, contamination, loss of tissue, other local factors such as vascular insufficiency, previous radiation and pressure, and systemic factors such as age, malnutrition or vitamin and mineral deficiencies, or diseases such as diabetes mellitus, or medications such as steroids, or immunodeficiencies such as in case of chemotherapy or cigarette smoking. So this was all about wound and wound healing in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.